All right, so belly breathing, or what we like to call it in the chiropractic world is diaphragmatic breathing. The whole point of belly breathing is to teach us how to activate our core more effectively so that we're stronger, more protective of our lumbar spine and associated structures. What we want to think about before we do this exercise is we want to envision our core being a can of soda. We have a diaphragm and we have a pelvic floor. And those two structures throughout the entire breathing cycle should remain perpendicular to each other, should remain parallel to each other, parallel to each other. That's the right one. As we breathe, we want to compress the air in our abdomen by keeping that parallel relationship and compressing the diaphragm down towards the pelvic floor, and then releasing that breath and the diaphragm raises back up. Just like with a soda can, if you open or crack that soda can, we lose compression around the outer edge. So with the diaphragm, if we lose that orientation by elevating the ribs or breathing into the chest, which actually lifts that upper part of the diaphragm up, we lose the compression and we weaken our core. So, Ian, if you will, one hand on your belly, one hand on your chest, I want you to take a nice deep breath and focus on filling that diaphragm or that belly with air. We should see movement of the lower hand and minimal to no movement of the upper hand. And for someone like Ian, who's trained, who's conditioned to do this type of movement, it's pretty easy. But what we want to do is challenge Ian, because this needs to apply throughout an entire range of motion. Whether it's lifting, hiking, biking, running, this has to just be a reflex. So, I'm going to sneak around here. What we're going to do, Ian, is we're going to bend your knees. We're going to bring those legs up. I'm going to support you here to start with. I want you to continue that breathing pattern. Breathe into the belly, relax through the chest.
Definitely harder.
Definitely harder. And it's going to get even harder because I'm going to take my hand out from underneath your leg. So I want you to do that support. And what we can see is some of that breath sneaking up into his rib cage, which is lifting up on that abdominal diaphragm slightly and reducing the potential pressure increase in the abdomen. Good. So Ian, go ahead and put your feet down to the table. I want you to take your fingertips, poke them down into your abdomen core, but right here. I want you to focus on breathing into those fingertips. Almost like every breath you take, you're pushing at those fingertips with the breath. Good, and he does a great job of keeping that chest calm. But as I talked about condensing a soda can, we're relating this to that. We want to be able to breathe 360 degrees around that core. So I want you to slide your fingertips out towards the lateral flank and continue to breathe and push that air into those fingertips. You should be able to kind of compress or push that air outwards all the way around to the spine. That's where it even gets more challenging. You'll feel it and then you'll kind of lose it. And you'll feel it and you'll kind of lose it.
Yep.
And as if you can see it in the video, but as he focuses on this, we're seeing a little bit more movement up in the chest. Good. Okay. Go ahead and relax. So this is something that I even like to practice even in the car if I'm at a stoplight. Not that we have a whole lot of stoplights or moments to do that here in Jackson, but that little brief breathe into the belly, relax as you exhale. It's a good element to practice, and it will apply to many, many things that you do in our lives here in Jackson.